After 50, certain dental dangers become invisible, meaning you can't see them, but they are still there lurking, waiting to cause damage. If you don't stop them now, you could pay a much higher price later. You know, if only I had known this sooner, I would have been more proactive about taking care of my teeth. As a cosmetic dentist who specializes in smile makeovers, I've seen my fair share of smiles that were neglected for too long until disaster struck. Don't let that be you. Stay tuned. We're going to reveal 7 of these hidden dangers today. And please stick around to the end where we'll show you how to stop them. Danger number 1, root cavities. When you hear the word cavity, what comes to mind? Probably a hole in a tooth. That's the visible part of the danger. But what about the invisible parts, the roots holding the tooth in place? After 50, your risk of root cavities increases significantly, especially as you enter your 70s and beyond. And the scary thing is you cannot detect them by just brushing alone. Brushing helps prevent and remove plaque and tartar above the gum line. But what about below the gum line? That's where root cavities lurk. Even if you have perfect brushing habits, these cavities can still form silently between the tooth and the gum, making them hard to spot. As they grow, they weaken the roots, causing instability and mobility in your teeth. You may not notice any pain or discomfort in the early stages. It's like a hidden vulnerability in your mouth, like walking around with a loose cannon, never knowing when it might fire. One misstep, and you could lose a tooth unexpectedly. Root cavities are challenging to treat once they reach the roots. Treatments include root removal, crowns, or in severe cases, extraction. However, if caught early enough, your dentist might be able to save the tooth with a filling or a crown. So, how does one protect themselves from these sneaky cavities? Your dentist has some answers. Danger number 2, silent periodontal disease. Gum disease doesn't always show obvious signs, especially in its early stages. This means it can go unnoticed for years, even though it's wreaking havoc beneath the surface. It's like a ticking time bomb. And the problem is gum disease is a chronic inflammatory process, so it continues to progress even when you aren't aware of it. Think of your gums as the foundation of your smile. Periodontal disease weakens this foundation through inflammation and infection. If left untreated, it can lead to loose teeth, bad breath, and even tooth loss. Here's the unsettling part. While gum disease can affect anyone, it becomes more prevalent and severe after 50. Many people assume that a bit of gum redness or slight tenderness means nothing serious. However, these symptoms could be warning signs of periodontal disease. Remember, regular dental checkups are your best defense. Your dentist can spot early warning signs that you may miss. During exams, they check for things like red, swollen gums, bleeding gums, loose teeth, and bad breath, all indicators of gum disease. Danger number 3, microfractures. Ever had a small chip on a tooth and didn't feel anything at the moment? Well, that's a microfracture. These tiny cracks often develop over time due to biting or chewing forces, and they occur just below the tooth enamel, making them invisible to the naked eye. Now, here's the catch. Most of the time, you won't experience any pain or discomfort initially. It's like having a crack in your windshield. At first, it's a small, insignificant-looking crack, but if left unchecked, it can spread and compromise the structural integrity of the entire windshield. The same goes for microfractures. Over time, they can expand and lead to full-fledged cracks or breaks. Imagine biting into an apple and suddenly experiencing a severe pain or having a tooth break off while eating. Not exactly a pleasant scenario. These microfractures can also leave you vulnerable to bacteria, leading to decay and infection within the tooth. Regular dental visits are crucial to spot these tiny cracks before they become big problems. Once they do become bigger cracks or breaks, treatment options include fillings, crowns, or, in extreme cases, root canals or extractions. Danger number 4, old fillings with hidden leaks. Those old silver fillings you've had since you were young may seem harmless, but they can harbor a nasty surprise. Over the years, these fillings can develop microscopic leaks around the edges. Picture this: you have a leaky faucet. At first, it's just a few drops here and there, but eventually it becomes a steady stream. These hidden leaks are like tiny openings in your teeth that allow bacteria and food particles to seep through. This creates an environment where decay can thrive, leading to new cavities. What makes this danger even trickier is that the leaks are so tiny you can't see them without special equipment, and many people don't realize there's an issue until a new cavity forms. To protect yourself, schedule regular dental checkups. Your dentist can identify these hidden leaks using special dyes or cameras and take steps to prevent further damage. Replacing old fillings not only helps stop these leaks, but also gives you a fresh, modern look. Danger number 5. Undiagnosed nocturnal bruxism. Have you ever woken up with a weird pain in your jaw or a strange taste in your mouth? You could be grinding your teeth at night and not even know it. This condition called bruxism tends to go unnoticed because it happens while you're sleeping. But don't underestimate its power. Over time, teeth grinding can wear down your teeth, causing flat spots or even fractures. It's like sandpaper slowly eroding the surface of your teeth. Now, here's the concern. Many people who grind their teeth don't know it until significant damage has occurred. You might assume that discomfort or pain means you're grinding your teeth, but that's not always the case. Some types of teeth grinding are almost silent, making them harder to detect. If left undiagnosed and untreated, this unconscious behavior can lead to severe dental problems. Wearing a night guard designed specifically for teeth grinding can help protect your teeth from excessive wear and tear. And remember, seeing your dentist regularly is essential to catch any issues early. Danger number 6. Advanced acid erosion. When stomach acid repeatedly comes back up due to reflux, it can gradually erode tooth enamel, leading to increased sensitivity and even the formation of cavities. Think of your tooth enamel as a shield protecting your teeth from the acids in your stomach. But when that shield starts to weaken or break down, you become more vulnerable to decay. Similar to reflux, a diet high in citrus acids or soft drinks can also lead to acid erosion. Each sip is like a tiny attack on your teeth, slowly wearing them down over time. It's like sipping on a corrosive liquid without realizing the damage it's causing. Protecting yourself involves managing reflux through lifestyle changes or medication and cutting back on sugary or acidic drinks. Regular dental checkups can help monitor the erosion, and your dentist can suggest ways to strengthen your teeth against future attacks. Danger number 7. Pre-cancerous lesions. Although rare, certain oral lesions can indicate a higher risk of cancer. These lesions can appear as red or white patches in the mouth, and while they're not cancerous themselves, they can develop into cancer if not addressed promptly. Imagine having a warning sign on your body that you aren't paying attention to. That's what these pre-cancerous lesions are like. The tricky part is they might not be very noticeable and can easily go unnoticed. If you happen to spot any unusual patches in your mouth, don't hesitate to consult your dentist. They have the expertise and tools to examine these lesions and determine the best course of action. Early detection and treatment are vital to preventing any potential complications. Wait, there's more. Let's talk about medication and dry mouth. Certain medications, such as antidepressants, antihistamines, and diuretics, can leave you feeling parched. And when your mouth is dry, it loses its natural defense mechanism. Saliva acts like a shield, neutralizing acids and washing away harmful bacteria. Without it, your mouth becomes a minefield for harmful bacteria and acids, making you more susceptible to cavities, gum disease, and other infections. This increased vulnerability means you need to be extra vigilant about oral hygiene and visit your dentist more frequently. Here's a simple test to check your saliva production. If you find that your mouth feels dry most of the time, and you often need to drink water to help with swallowing, then you might have a problem with decreased salivation. What does your dentist actually look for during a routine exam? Well, they're trained to spot those hidden dangers we discussed. During a checkup, they thoroughly examine your teeth, gums, and oral tissues, checking for signs of decay, gum disease, lesions, or any other abnormalities. They also assess your overall oral health. For example, your dentist checks for cracked teeth, which may not hurt initially but can lead to more extensive problems down the road. They look for worn tooth enamel, a sign of acid erosion or teeth grinding. Additionally, they examine your gums for signs of periodontal disease, including redness, swelling, or bleeding. And don't forget about those hard-to-reach places. Your dentist uses specialized tools like mirrors and explorers to peek around your teeth and under the gum line where decay and tartar might be hiding. Finally, they take X-rays to see what's happening beneath the surface. This comprehensive approach ensures that no hidden danger goes undetected. What technologies do dentists use to reveal these invisible dangers? Well, they have some cool tools at their disposal. X-rays are a staple, allowing dentists to peer beneath the surface of teeth and gums to spot cavities, gum disease, or other hidden issues. Intraoral cameras are also handy, enabling dentists to see a close-up view of hard-to-reach areas in your mouth. These cameras provide detailed images, helping spot tiny cracks, lesions, or signs of gum disease. Additionally, there are devices that check for tooth sensitivity, giving insights into the strength and integrity of your tooth enamel. And let's not forget about the digital impression. Instead of the gooey impression material, a digital scanner creates a 3D model of your mouth, aiding in early detection of changes or developing problems. Are there any prevention strategies that change as you age? Absolutely. As we age, our mouths go through changes that require different preventive measures. As you get older, the texture of your teeth may change, becoming softer or more prone to erosion. This means that the type of toothpaste you use should provide additional protection. Look for products specifically designed for older adults that focus on strengthening teeth and counteracting the effects of aging. For example, using a soft-bristled toothbrush becomes increasingly important to avoid gum recession or tooth sensitivity. And don't forget about fluoride treatments. They can help strengthen your teeth and make them more resistant to decay. Ask your dentist if you're unsure which ones are suitable for you. Can systemic diseases affect oral health? Oh, yes, absolutely. Systemic diseases like diabetes, osteoporosis, and autoimmune disorders can significantly impact oral health. They can weaken your immune system, reduce blood flow to the mouth, and alter your hormone levels, all of which make you more susceptible to gum disease, tooth decay, and slower healing. It's crucial to manage these conditions effectively to protect your oral health. By keeping your systemic diseases under control, you can reduce their impact on your mouth. Work closely with your healthcare providers to manage your conditions, follow their advice, and make necessary lifestyle adjustments. What common myths leave you vulnerable? One common myth is that as we age, we lose a tooth a year. While tooth loss is a concern, it's not inevitable. With proper oral care and regular dental checkups, you can keep your teeth for life. Another myth is that older adults don't need to worry about cavities. But here's the truth. As you get older, your risk of cavities actually increases, especially if you're dealing with dry mouth or have developed new dietary habits. Are there any hidden signs that something invisible is wrong? Yes, indeed. Bad breath, persistent dry mouth, changes in your bite, a sudden sensitivity to hot or cold, and swollen or tender gums could all be signs that something is amiss. If you notice any of these red flags, don't ignore them. Schedule a dental appointment and let your dentist investigate. What is the cost of ignoring these dangers? The cost can be high, both financially and emotionally. Emergencies like severe tooth decay or infections can lead to unexpected dental expenses. Ignoring these problems can also result in more extensive and expensive treatments down the road. For instance, a small cavity that could have been treated with a simple filling might turn into a root canal, or even tooth extraction if left untreated. How do you protect your smile and overall health? Prioritizing your oral health is key. That means brushing twice a day with fluoride toothpaste, flossing daily, and eating a balanced diet low in sugars. Regular dental checkups and cleanings are also essential. They allow your dentist to identify and address any issues early when they're easier to treat. And don't forget the importance of a healthy lifestyle. Managing stress, getting enough sleep, and exercising regularly support not only your oral health, but your overall well-being. Here's a self-assessment checklist. Ask yourself, do you currently smoke or use tobacco? Do you consume alcoholic beverages on a daily basis? Do you suffer from diabetes or another autoimmune disease? If you answered yes to any of these questions, you might be at higher risk for oral health issues. Take extra precautions and schedule regular dental checkups. Remember, your mouth is your first line of defense against the outside world. Give it the love and care it deserves, and it will serve you well throughout your golden years. Don't wait for pain or an emergency to discover what's hidden. Your mouth deserves the truth, and your health demands immediate attention. Now that you're armed with the knowledge of these invisible dangers lurking in your mouth, what will you do to protect your smile and health before it's too late?